Now, this is a little fun fact. If you've injured your spine at work and you see a chiropractor, your chance of surgery is 1.5%. But what if you saw your medical provider first? Well, then you have a 42.7 chance of getting surgery. So who you see first matters. Again, this is an interesting study, 2013 in spine. Bottom line, see your chiropractor first. Find a smart injury doctor in your area. And then this also gives us information on return back to play. When someone's injured, they may not be able to go back to play. Well, how do you know for contact sports? Well, it depends on how much excessive motion there is. So if there's the more ligament damage, the more movement, the more instability. Now, this talks about osteoarthritis. What's the chance of you having arthritis in the future? It's really simple. If your spine moves too much or not enough, it's going to break down faster. One more time. Too much or too little motion is causing the spine to get arthritis. Now, 3 possible spinal injuries to work up: fracture, support ligament damage, or a disc. You need to have those 3 evaluated. The most common missing link is the support ligament test. And if we injure the support ligament, what happens? It leads to chronic pain. Some of these research studies show 88% at a 10-year follow-up. Some of this research shows 44 to 90%. So those are terrible statistics if you've had a whiplash. So you need to find a smart injury doctor. And not only are these ligament injuries painful, not only are the most common cause of disability, they're expensive. The first leading cause of pain and disability is low back. The 4th leading cause is neck pain, and the 6th leading cause is headaches. That information is from the American Pain Society, the American Physical Therapy Association, the National Library of Medicine, the Mayo Clinic proceedings. The bottom line, support ligament injury is missed, it's serious, and it's progressive if you don't fix it. So, not only are they expensive, I don't want to get into the details. In my clinic, these people don't incur those costs. Why? Because we know how to diagnose them, we know how to treat them, we know how to manage them. This only gets to be excessively expensive when they're not diagnosed, they're not treated, and the acute injury goes chronic. So to avoid pain, to avoid disability, and to avoid those huge costs, get a diagnostic motion x-ray by a smart injury doctor. That will guide your treatment, your home care, your rehab, and we want to avoid this. So again, why are these costly? Why do we have chronic pain? Because the most problematic, remember that slide I showed you with the pyramid? The most common injury is not diagnosed. Think about that. Common sense, the most common cause of chronic pain and disability is a ligament injury. And that is only diagnosed by a motion study, putting your body under stress. Think about it. A lot of people feel no pain at rest, but when they load their body, when they move, they have pain. That's why you need to get an excessive motion test to get a correct diagnosis and correct treatment. And bottom line is, how can you properly treat an injury that was never diagnosed? 3 main injuries to the spine: fracture, disc, or supinal support ligament. They have different symptoms, and they're diagnosed different, and they are treated differently. So again, I constantly stress chronic pain, make sure you get an excessive motion test by a doctor in the Smart Injury Group.